Hello. Hey, I wanted to talk to you about the basics of Medicare, what people call or refer to the Medicare 101. And that's really what we want to talk about, the basics, so it's easy to understand. A lot of people get confused about Medicare, and if you think about it, it really is four main parts. You have Part A, Part B, Part C, and Part D. A is hospitalization, B is medical, also known as doctors. C is Medicare Advantage, or Part C, and D is prescription drug coverage. And really, if you focus on those four main parts of Medicare, you'll make your life a lot easier. So let's kind of talk about what Part A is. Part A, hospitalization, is an entitlement. As long as you work for 10 years or 40 quarters, you are entitled to Part A under Medicare. Now, Part A does not have a monthly premium for most Americans, but it does have a deductible. So if you go to the hospital and you have Medicare alone, Part A has about a $1,400 deductible this year. That $1,400 deductible is paid after you go to the hospital. So I'm not going to normally ask you to pay for it up front. You're going to get a bill from the hospital. Part B is your medical, and that's going to have a whole bunch of things that fall under it. Things like doctor's visits and specialists and physician services and chemotherapy and radiation and drug infusion. There's a whole long list of things that are covered by Part B. And Part B is not an entitlement. Most Americans are going to pay a monthly Part B premium. And that ranges, it's right around $145 a month right now, but it can go up or down, mostly up, every year. And Medicare Part B also has a once a year Part B deductible. Now in 2020, that deductible is $198. So if I have Medicare alone and I go to the hospital and it's the first time I've used my Medicare that year, I go to the hospital, I owe about a $1,400 deductible. And for the physician's charges, I have a Part B deductible that's one time a year. So I've got to meet the first $198 on medical expenses. Once I've met that Part B deductible of $198, then I'm responsible for 20% of the cost of my medical expenses. Now, when we're talking about expenses, keep in mind that's anything that Medicare covers. So if Medicare covers your doctor's visit, Medicare covers your chemotherapy or your radiation or your physical therapy, you'll pay that Part B deductible and then 20% coinsurance. And one of the things that can be a real hardship for people is that Medicare does not have a cap for that 20%. So if you go to the doctor or you have chemotherapy, you pay that 20% coinsurance throughout the year, with no limit to your out-of-pocket costs until it resets the next year in January. Okay, so that's Part A and Part B, and that's a very simplistic explanation. Then you have Part C. Part C are private insurance companies known as Medicare Advantage or all-in-one plans, and those are specific to the county you live in, and even some states the city you live in, zip code by zip code. And there's lots and lots of options for that in many counties around the United States. Those plans are going to work a little differently. They're going to have a lot of times networks, so you've got to stay within the network. And depending on where you live, that might be really easy. There may be lots of providers that take it, or there may be just a few, or none at all. Just depends on where you live. These plans have become more and more popular because they're very, very reasonable in their premium and their copays, and they have to cover everything that Medicare would cover, but there are some restrictions and there's some things to know about them. And there's a lot more detail we can go into each one of these parts of Medicare, but that's the basic. Part D is your prescription drug coverage, and since 2006, Medicare said that anybody who's eligible for Medicare and does not have coverage for Medicare Part D from another source, like an employer plan that's considered credible by the government, veterans benefits, a retirement plan that includes creditable prescription drug coverage. If you don't have one of those scenarios, then you have to get it from a private insurance company when you go on to Medicare. And Part D, drugs, is exactly what it sounds like. It covers your prescriptions. There's lots and lots of choices. In most counties, there's 20 to 30 different choices for these plans, so we've got lots of options. But really the basics to understand is A and B is what we call original Medicare, and that comes from the government. Most people are going to go on to that when they turn 65. Unless they are on Social Security disability, they might go on to it a little earlier. Part C is private insurance companies. Those are the Medicare Advantage plans. And then Part D is your prescription drug coverage. Now, The Medicare Advantage plan a lot of times can include your prescription drug coverage, so keep that in mind. And of course we can go on to Medicare supplements, Medigap plans, all the different types of Medicare Advantage plans are out there, but really if you understand Part A, Part B, Part C, and Part D, you're off to the races and you have a good understanding to kind of start your education. And in future videos we'll talk about the rest of the benefits. Okay, thanks a lot and have a great day.